Okay, so we have a 12-year-old boy who presents to the pediatric department with 4 months history of intermittent pain in his left hip, and he limps. The pain is worse when running, and he takes ibuprofen. He had tonsillectomy when he was 5, and his mother does suffer from hypothyroidism. On examination, the left hip is flexed and there is a restriction of internal rotation, abduction, and flexion. No other joint abnormalities are seen. He weighs 56 kg, which is between 91st and 98th centile. On the right, you can see his blood test results and a lateral hip X-ray. So I'll give you 5 seconds to pause the video and come up with a diagnosis. Okay, so the correct answer is slip upper femoral epiphysis, or SUFI. So let's work this out together. Uh, Juvenile idiopathic arthritis. This is when several joints are affected, but then in our case, we have only one joint here. And we do have pain and swelling and warmth and restricted movement of several joints, so we can easily rule that one out. We have developmental dysplasia of the hip. This characteristically presents in patients who are between the age of 0 and 3-year-old, but then our patient is 12, so we can easily rule that one out as well. Septic arthritis. Looking at the white cell count and C-reactive protein as well as ESR, they are all within normal range. So then in septic arthritis, because it's inflammation due to infection, these tend to be raised, mostly due to Staphylococcus aureus, so you can easily rule that one out as well. Duchenne muscular dystrophy. This is primarily a condition that involves the muscles, but then in our case, there's no sign or symptom that this points us towards a muscular condition. DMD is when a protein called dystrophin is absent, and a milder version of DMD is the Beck's dystrophy, which is when there's dystrophin, but then in small amount. People have difficulties raising from seated position or climbing the stairs, and Gower's sign is positive, so we can rule that one out as well. Looking at the lateral hip X-ray, we have been told that the anterior X-ray of the pelvis and hip are normal. This can happen even if there's SUFI. For that reason, we have to, or we always have to carry out lateral hip X-ray so that we don't miss SUFI. Otherwise, it's bad. It can lead to avascular necrosis of the hip. So looking at the lateral hip X-ray, we can see that there is a bit of displacement here, and that is evident by the fact that if we draw a line, we go like that. There is the slip bit. So let's learn a bit more about SUFI. So the clinical features include that it's more common in boys. Patients tend to be obese or overweight, which is the case in our patient, because he weighed 56 kg, which is really high for his age. He had growing pain, which the pain can sometimes refer to the knees. Sometimes there's endocrinopathy, such as hypothyroidism, hypogonadism, and growth hormone abnormalities. And in fact, in our patient's case, he was later found to have thyroid peroxidase antibodies, which confirm Hashimoto's thyroiditis. Management, it is urgent. We have to admit them urgently, otherwise it can lead to avascular necrosis of the femoral head. Surgery will involve pinning of the femoral head to the femoral neck. Again, this is a cartoon to show you how CV looks like. So that's the growth plate, and you can see that the femoral head has slipped from the growth plate. So if you think about it, it does make sense, considering that it mostly happens in overweight and obese patients. So if you apply more weight here, so obviously there is more chance that this can slip away. That's the way how I remember it. Investigation. Again, a small slip may be missed on anterior-posterior view, so always do a lateral leg view so that you don't miss it. Hope that was useful.